My name's Jason McClure. I'm 40 years old, and 2 months ago, I had a heart attack. I work at JC Blair Hospital in the engineering department. I've been involved with the planning of the new cath lab. Little did I know, I'd be the first patient. That morning I was not feeling very well. My wife called my boss and asked him to keep an eye on me. He took one look at me and sent me to the ER.
That was the first day that we were supposed to open the cath lab in JC Blair Hospital, and I was scheduled to do the first case in the lab at 8 a.m. On my way here, I got a call that somebody in the ER was having chest pain for some time, and the electrocardiogram is showing acute heart attack, and we're probably going to do his case before the first scheduled case.
I'm very active after work. I'm a president of a soccer league. I also coach. It really surprised me when I found out that I was having a heart attack.
He was taken up to the cath lab. We did the first angiogram on him, and we found 100% blockage in the artery on the right side of the heart. If the vessel was not open, he would have lost, a big part of his heart muscle.
One of the great things of having the cath lab here, patients don't have to be transported, and we can save lives here at JC Blair.
I was able to pass a wire and a balloon in this in a very few minutes, and we put a stent in it. It looked very good.
The team from JC Blair, from the ER to the cath lab to the ICU, were awesome. They really made me feel like family.
Our cath lab team here is very good. They all have very good experience. They're personally selected by the staff and administrations, and they're very helpful.
When they were wheeling me up to the cath lab, there's a lot going through my mind as far as my family and what they would do without me. So it means a lot to have that cath lab here at JC Blair.
We're now able to do all the diagnostic and therapeutic interventions that we were not able to do before, including heart catheterizations and coronary stenting and peripheral vascular stenting.
So in healthcare, we have a saying, time is muscle. The quicker you can get to the cath lab after a heart attack, the better.
Now he's doing very well. He's going back to his usual life, taking his medication. He is being followed up very closely, and he has no significant limitations in his life.
Since my procedure, I feel great. My energy level's been up, and I feel like I got my life back.